Hi, and welcome to Politically Speaking, Insights and Issues. I'm your host, Dave Szollosy. Now, much has been happening lately with respect to the current pandemic. In recent weeks, we have seen the rollout of the highly anticipated vaccines, and at the same time, we've seen the emergence of new strains of the virus. In York Region, we have had over 23,000 reported cases of infections and over 400 deaths. Currently here in Georgina, we have 40 active cases. And York Region has been in lockdown since Christmas. Today, we're talking about the disease, its spread, and when you can look forward to being vaccinated. My guest for the first half of today's show is Dr. Fareen Kirchawala, the Associate Medical Officer of Health for York Region. And welcome back to Politically Speaking, Doctor.
Thank you so much, and thank you for having me today.
So first off, I'm going to ask you if you can just give us a general update on the current status of the pandemic control here in York Region. What is the effect of the current lockdown? Is it working?
Those are great questions. Yeah, so starting with our current situation, we are seeing, quite high case counts, as has been really the trend since early September, going up. As you mentioned, we have had over 23,000 cases in York Region and upwards of 400 deaths. Some slightly promising news, although it's too early to tell right now whether or not that's going to be a continued trend or not, is since about January 6th to 10th, we are seeing a bit of a decline in terms of our rates, in terms of our 7-day moving average. So for example, on average over the past week, the number of cases we get per day is around 260, which is down from what we were seeing end of December, right at the start of January. So a little bit too early to tell whether this is because of the lockdown, much too early to tell if this is because of the new provincial stay-at-home order. But it's really dependent on behavior. And I think a key thing to point out is that what we'll see from here going forward really depends on the number of contacts that people have, whether they're abiding by that advice to stay home and really limit your interactions. So we could see it come down and plateau. It could just be sort of a coming down after the holiday season where there might have been some further gatherings and things like that. So it's a little bit early to tell, but some promising news that I do want to share.
So Toronto, Peel and York Region, as you referred to, all saw the post-Christmas increases in active case rates. Wasn't that a predictable event in the absence of a complete lockdown?
I think it's hard to say. I mean, in some ways, could be predictable. It is a time of year where people are getting together with close contacts in homes, perhaps. And we still know that one of the driving factors of transmission here is that close contact, so being indoors with people for a prolonged period of time outside of your household. That being said, some of the projections we saw in terms of like if people are moving around, going to work, that actually did decrease. So quite a few people were following the rules, sort of despite the provincial landscape. But then there's things like travel as well. So really a complicated picture trying to weave all these things together. I think to some degree, authorities predicted a bit of a rise. But that being said, as you mentioned as well, there are new variants we're seeing that are easier to spread, things like that. So lots of different things at play. But we're very hopeful that with the stay-at-home order that's now in place, which we're very much in support of, that those numbers can keep either being declining or sustained. And luckily they are back to what we were seeing pre-holidays at this point in time anyways.
Yeah, we were joking earlier that some of us appreciated the excuse for not having to socialize with a lot of people over the holidays. It made it a lot less stressful for many. But York Region Health too, was initially against imposing restrictions here. And I know the medical officer of health, Dr. Kirji, said the region wasn't seeing outbreaks traced to retail establishments, restaurants, gyms, or places of worship. Is that still the position for the region, or are we seeing that the provincial order for lockdown was necessary to bring the numbers down after the Christmas holidays?
Yeah, so as I said before, it's such a complex mix of different factors with, mobility and new variants and where are we actually seeing spread. I think what we really wanted to point out is that there's a delicate balance, because what we know is that when you do have, economic implications, things going on in business, people struggling financially, that as well has a huge impact on not only the health of somebody, but how health is distributed in our population, with some people being quite a bit worse off when it compares to others. And of course, you look at things like the mental health toll, and all that's happening. It's a big thing to consider. And so it's a really tough thing to say what the exact right mixture of interventions is. Is something like a curfew more effective than something like closing restaurants? And I think because we're in totally unprecedented times, it's so difficult to say. So our position has always been that we're in support of what the provincial government decides. They've convened expert bodies, expert tables, having all these policy discussions. And what we were trying to avoid seeing is a complete patchwork across the province, which resulted in people moving across to, from high incidence areas to low and things like that. And so we were really trying to take and heed the advice of the provincial government. So currently with the stay-at-home order, we are quite in support of that, and we're hopeful that since that's been implemented on the 14th, that we will hopefully see a decline or sort of a sustained trend at least.
I'm just wondering, because you mentioned now the mental health in the community, and that's something that people have referred to a lot. I don't know if you're keeping tabs on what's happening in that area, or if you have any quantitative data that what's happening. Is the pandemic, is the lockdown having an impact on people's mental health, or is that just something we're experiencing? What's the term? Just by reference?
Yeah, no, there definitely is evidence and data to support that. So short of sort of local information, we do track things like opioid overdoses, for example, which there was sort of a gradual increase in, which was happening pre-pandemic as well, I should say. But there's some really good provincial information from an organization called Public Health Ontario that has actually looked at those mental health impacts. So looked at it for youth, looked at it for adults, and all those spillover effects. And there's quite good information from Ontario, but also from other countries, other places, that there is a significant impact of things like loneliness, social isolation. I mean, those were huge things driving our health even before the pandemic. And in many ways, it's worsened things. But I do want to point out that everyone's experienced this quite differently. So, there for some people, school attendees, there might be reduced pressure, just like we were talking about with the holidays in terms of peer pressure, going to school, or bullying. Some of those factors might be better with virtual learning. But in a lot of the cases, we are finding that, it's such a human thing to connect with someone, and in some ways feels, unnatural to be distanced and masked and all those things. And those could have impacts. And I should say, we know it in kind of the short term, because of course this has been around for roughly a year now. But long term, we don't truly know what the impact will be on social connectedness and trust and just, community feel almost.
Now, we still have to get local transmission of the virus under control. And because we're delayed in getting the vaccinations out. We know that testing and contact tracing is key to this. Where is York Region with respect to testing now?
Yeah, it's a great question. So the testing is still occurring at our 4 assessment centers in the region, and it's quite active. So roughly speaking, we'll get about 2,000 tests being done in a day. And these might include people who live outside the region as well. And I'm glad you asked about our sort of case and contact tracing efforts, because they have been quite strong. There was a period of time, a couple of weeks ago, where we were quite overwhelmed with just the sheer volume of what we were seeing. I'm really happy to report that this has gotten quite a bit better and sort of clearing our backlog. And we are making very timely contact with each of our cases, asking them to isolate, quickly put a ring around their close contacts to stop that spread. So that is happening quite well right now. But I just want to remind people that, as this goes on, people are having more contacts and more exposures. So the more we can limit that and the sort of kinder we are to our investigators and forthcoming with information, the better it is. And we've started adopting some technological tools as well, like a virtual assistant that people will get a link to via text message, which helps the process move along a lot more efficiently.
Can you explain that to me a little bit? I'm not sure I understand how that works.
Yeah, absolutely. So what it is a kind of like an online survey. And so if you are a confirmed case of COVID-19, we may reach out to you by text message first. There's a link, a confidential link to a survey that all the information is private, it's voluntary to fill out, but it allows us to get as much info as possible before actually connecting by phone to tease out a few more details. So a big time saver, and people can do it sort of at their own convenience as well, which is very nice.
Now, to what degree, too, are we seeing the variant virus emerging in York Region? And I think there's some cases that for which there's no ties to travel. And what does its emergence mean for personal protection?
Yeah, a really good question. So just to paint a bit of a picture, Canada-wide, when we're looking at the UK variant, there's been about 23 cases. In Ontario, roughly 15, and these numbers are sort of changing each day. And in York Region, we've seen 7 actually of the 15 in York Region. So it's a bit of a sample. It doesn't represent all of what's out there, probably underrepresented. But 3 of the 7 in York Region were not linked to travel, meaning they themselves didn't travel and they did not have contact with anyone who was a case who did travel. So it indicates to us that this is spreading in a community transmission way. It's not all linked back to exposure from a different country. So there's probably more of them out there. This has been seen in other areas as well. In terms of what it changes, I mean, the messaging and the interventions stay the same. So even more important, regular and thorough hand washing, staying home and getting assessed and tested with any sign of a symptom. Maintaining that 2-meter distance, that does not change with this variant at all. Maintaining that masking indoors and outdoors now, which is the new recommendation actually, is even when you're outdoors and within 2 meters of somebody to wear a face covering or mask. So we're tracking it. It could be easier to spread is what it looks like. But in terms of those control measures, it's ever more important now to stay at home, only associate with members of your own household, and really heed to that stay-at-home order.
Now, I think this is the key thing that people are concerned about, the increase in contagiousness, if I can say that, of this variant virus. I know initially when the pandemic started, I was washing all groceries and everything coming to the house, and I kind of backed off because I thought, well, it's not really surface transmitted. Does this virus change our attitude towards surface contact as well as aerosol spread?
Oh, that's a great question. Yeah, so we do think it could be spread up to almost 60 to 70% more easily. But keynote is it doesn't necessarily result in more disease, like more very sick people or hospitalizations or deaths or anything like that. But in terms of how it's spread, it's still pretty much the same. So it's that contact droplet. Still, the main mode is speaking face to face with somebody for a prolonged period of time. The whole transmission through contact surfaces, it's still possible, but it's not the main route. Same thing with aerosol. It's possible if you're in a small, poorly ventilated room, which has sort of always been the case. But the variant piece of this doesn't really change all that. But I would still say we've always been saying since day one that regular environmental cleaning, that disinfection of commonly touched surfaces like door handles, light switches, things like that should most definitely continue.
Okay. Now, in our last minute, I don't want to tie you to any predictions, but what are the current expectations for both the numbers and the measures being taken to control the virus? Are you anticipating recommending any further controls?
Yeah, it's a great question. So when we look at modeling data, which is projecting what's going to happen into the future, that's happened both at the Canada level and at the provincial level. And it really depends on behaviors and whether people are limiting their close contacts or not. So we could see a growth in that scenario.
And you know what? I'm going to have to ask you to finish that thought when we come back from break.
Absolutely.
Okay? And I'll ask you the number again. Stay with us for Politically Speaking, Insights and Issues. Hi there, and welcome back to Politically Speaking, Insights and Issues. I'm speaking with Dr. Fareen Karichiwala, who's the Associate Medical Officer of Health for York Region. We're talking about the vaccine. We were just talking before the break about the predictions or expectations of increasing numbers before we actually get this pandemic under control. So, Doctor, what were you saying about the anticipation of spread and expansion of the numbers we can see over the winter here?
Yeah, definitely. So, we have had some recent modeling projections done at both the provincial level and the federal level. And both of those show that it really depends on if people start, limiting their contacts to a significant degree or not. Interestingly, if you look at people's mobility and what they were doing in wave one compared to now, people reduced their travel, their interactions with people by about 60% in wave one. In wave two, we're seeing that closer to actually anywhere between 20 to 40%. So a big difference in terms of what people are doing. And the projections really depend on that. So if we are to continue as we are now in terms of number of contacts and travel and going out and about, we would see an increase and could very well see ICU beds stretch, which they're already beginning to be stretched, hospitalization capacity issues and all things like that, and deaths rise as well, of course. But if people do limit their spread, we could start to see a bit of a plateau and maybe a bit of a decline. It's a little early to say what the stay-at-home order is doing, because of course that was just implemented not too long ago. But hopeful that if people really heed that advice and limit the number of contacts, similar to what was happening in wave one, it could make a really significant difference in terms of preventing cases, preventing deaths, and preventing our system from being overloaded.
Now, you're talking about the overloading of the system, and that's another concern. That's actually number one concern for the management of public health, to have the access for that. I'm hearing now reports, so that some York hospital beds are at 103% of capacity, and that we've had to start moving patients around to different hospitals around the province in order to make sure that there is space. Is the hospital, I'm using a quote here from one report, on the brink of collapse? Is our hospital system on the brink of collapse?
Yeah, it's a good question. And I don't want to speak completely for the hospital, because of course that's a bit of a separate role with public health. But yeah, a lot of our hospitals in York Region were quite stretched even before the pandemic. You would have heard terms like hallway medicine, not enough space in the beds. So definitely they've always been stretched. And we're actually approaching levels now that are quite high. So if you looked at hospitalizations in wave one compared to now, we're actually starting to exceed that level in wave two. And so the concern is, if we're not doing the stay at home and not limiting our contacts and where we go and following all those measures, that could very quickly be surpassed. And so, of course, the system is an issue, but just the impact of having a loved one that's sick or that's passed away is a huge emotional toll on a family and a community. So all of those things are really important when it comes to the public health goals of this response.
Mm-hmm. I want to start talking a bit more about the vaccination and vaccination protocol now, because South Lake Regional Health Centre, in partnership with the region, I believe, has opened a COVID-19 vaccination centre at Ray Twinney Recreation Complex in Newmarket. Now, it's not open to the general public yet, but the anticipation is it's going to be able to deal with 1,000 people per day to get vaccinations. I know that the region has to follow provincial prioritization. So what is the schedule planned for vaccination? Who will be vaccinated when?
Yeah, it's a good question. I know it's something that people have lots of questions about, and some of this is in current active discussion. But probably the best information is from the provincial plan that's been articulated. So there's 3 different phases that they've spelled out. And right now we're in phase 1. And that lasts, so we're thinking about March or April, though, as you mentioned, with some of the delays that might have an impact. It's hard to tell at the moment. But phase 1 is really long-term care, retirement home residents, staff and essential workers in those places. And then healthcare workers that are at very high risk and high priority. So hospital workers predominantly, and then working our way through other sort of frontline facing healthcare workers. Also, Indigenous communities are within that phase 1 rollout. and people receiving sort of chronic home health care. That's another group that's really prioritized in phase one. And then as you move to sort of spring, summer, we're getting into phase two, which would be other frontline essential workers, people that might be working at things like shelters, for example, or other social services or client-facing interactions. And then people that just tend to be high risk. So community people that aren't in homes, that are elderly, a very important group, very important group. And people that might have medical conditions that put them at higher risk. And then of course, the goal with phase three, which is kind of further into the summer, is that anyone who wants a vaccine would be able to get it. And we're hopeful by then that there'll be a whole range of vaccine products available, not just sort of 2 or 3. And that, like you mentioned, with the Ray 20 and things like that, we're in active plans to figure out how do you roll this out on a mass public level. And all those plans are already articulated. We're working with our partners. And you might know from sort of flu days that we were actually testing out some of these models. So like a drive-through clinic, what does that look like? And some more innovative models that have been used in different countries.
Like I understand there's plans for some larger clinics, including I think Canada's Wonderland has been named, Markham Fairgrounds has been named. Is there anything being looked at for the northern parts of the region where transportation is more of an issue?
Oh, yes, absolutely. Yeah. So when we're doing this planning, we're looking at the population in general. So part of it's like, where do people live most often, but also who might have a harder time accessing this for a range of different reasons. So a huge priority for us has always been protecting those most vulnerable and recognizing some of the barriers that people might face. Transportation definitely for the North is a huge issue. So we're looking at models like mobile clinics. Can we get out to meet people where they actually are? That's one factor. And then just looking at even the timing of the clinic. So we know a lot of people work during the day. Not that easy for them to get out between the hours of, 8 and 5 or something like that. So looking at weekend hours and weekend clinics and things that go into the evening. So that's always been a huge consideration of us for ours, because we want this rollout to be fair and equitable.
And you did make an allusion to the recent announcements by Pfizer regarding limiting shipments to Canada. Is that seen as going to be impacting the schedule you just outlined, or did the schedule take that into account?
Yeah, no, we do expect that might impact the schedule. A lot of the procurement of actually getting vaccine into the country is happening at the federal level and then the provincial level. So locally, we don't have too much influence over that, but we are told that the delay will impact things. I think it's really hard to say timeline-wise how long it'll delay things. But right now, the focus remains on long-term care, retirement homes. And actually, we've made very good progress in York Region. Vaccinating our long-term care residents and staff. There's 28 long-term care in York Region. Those are quite underway, almost done. And same with our 34 retirement homes, which is really great because the areas with higher transmission, York Region included, was supposed to get that done quite early. So we're making great headway when it comes to that and are very pleased with that.
Now, this vaccine isn't understood by a lot of people because it's a novel kind of vaccine using messenger RNA as the agent. Mm-hmm. Can you explain how this works and how it's different from other more traditional kinds of vaccines like the flu vaccines that people are more used to?
Yeah, absolutely. No, I'm very happy to explain it. And so it is called mRNA technology. And I want to point out that mRNA is messenger RNA, right? Exactly. Yeah. So I'll explain what exactly that is. But just to note that technology, it hasn't yet been applied to vaccines up till now, but it has been used in other treatment modalities. So for cancer treatments and other types of chronic diseases. So it's not completely brand new and people do have experience with it. What's really neat about that is when you look at traditional vaccine development, you're spending lots of time actually manufacturing the proteins or the particles that will help stimulate an immune response. With mRNA, you're providing a genetic code and that gets into your cells, and then your own cell's machinery will work to produce that particle that gets you an immune response. So that's part of the reason why the timeline on this was actually a bit shorter. So people were worried, oh, are they cutting back on the research? And that's not the case. There's still very vigorous standards in place, very vigorous standards in terms of clinical trials, showing the safety and showing the effectiveness. What's kind of neat and unique here is that our own cells are being used to do what would be done in a manufacturing plant that could take years and years. So that's kind of the neat thing about it. And rest assured that Canada has an extremely robust monitoring system. So literally at every level of government, we are tracking adverse events, any reactions. A group of experts looks at that to see if it's associated or it's just a coincidence. And so have a nice method to actually detect safety signals.
Yeah, that's what you're speaking about, the different timeline with which this vaccine is produced has been the source of some comments in social media that the vaccine was rushed. It hasn't followed through the normal patterns, the normal regimens for approval. So there's a lot of reports of people experiencing what's being labeled as vaccine hesitancy. How would you answer people's concerns about getting the vaccine? Mm-hmm. Or on the other hand, too, are there people who should not get the vaccine or groups for whom the vaccine has not been tested?
Yeah, for sure. It's great questions. And, I think a healthy skepticism is always good. We want people to think critically. We want you to seek out your information. But what I would say is that the process for the scientific studies was not rushed. What happened, at least in Canada, was just some regulatory changes to allow for clinical trials to overlap in timing, to get the info to Health Canada faster. So a lot of it was kind of efficiencies in the system, which is kind of nice and may end up being the standard going forward. So you're not withholding life-saving interventions, on a larger scale. So that's one thing to keep in mind. In terms of, just people being hesitant and skeptical because it's newer. That's fair, but I think it's really important to know that this is one of those interventions, and vaccines in general, they're safe, they're effective. This is not a live vaccine, which is really important to know. A lot of people think, maybe it's live, or maybe that genetic code gets incorporated into your own cells. And it does not. So it doesn't come close to the center of the cell where your own genetic material is. It's degraded really quickly. So all of that we know from sort of years and years of working with this messenger RNA as a product. And like I said, it's not a brand new technology. So by and large, most people are eligible. There are a couple of groups that were sort of left out of this study, and now we're kind of grappling with who should get it and who shouldn't. The one group that shouldn't get it is if you have had an anaphylactic, very serious, very immediate allergy to any component of a vaccine, of this vaccine, I should say, then you're not in the group to get it. And for some of those groups that weren't included in the studies, there's quite a good evidence thinking that it's probably still safe, but you would have those discussions with your healthcare provider, who's probably in the best position to counsel you about risk and benefit. And as the science evolved, we're just going to get more and more information on safety and these smaller subgroups of people who may or may not have been included in the trials.
So we have about a minute left, Doctor, and maybe the last question, just to repeat, while people are waiting for the vaccine, what should they do?
Great question. So it's so important that while you're waiting for the vaccine, you continue to follow public health advice. So this does mean stay home. Do not go out into the community except for very essential trips. So urgent medical appointments, pharmacy, groceries, and even that, try to have just one member of your household go. Do not mix with other households unless you live completely by yourself, and social isolation is a big factor, then pair up. And the usual, wash your hands thoroughly and often, wear a mask. If sick at all, don't go out and get assessed and tested. It's very important. And above all, continue to be kind to one another. This is impacting people differently. That reaching out and that social connectedness is so important. I just want to briefly say
thank you so much again for coming back on the show. It's really good to see you again. Take care of yourself as well, and under the extra burden that you're working with right now. Stay with us. We're coming back on Politically Speaking with Regional Councillor Rob Grossi. Welcome back to Politically Speaking, Insights and Issues. I'm your host, Dave Szollosy. As well as the COVID issues, another news item that has been pressing is the future of the very controversial Upper York Sewage Solution. Joining me now in the second half of the show to talk about these questions is Georgina Regional Councillor and Deputy Mayor Rob Grossi. Rob, very good to see you. Thank you for coming on.
Great to see you as well.
Good. And hopefully you're keeping safe under these pandemic restrictions and happy.
Yeah, crazy times, but you know what? If I can remind your viewers, call a friend, visit a neighbor, make sure everybody's okay. It's times like this when we all come together.
And you know what? That I'm really glad you said that, Rob, too, because that's something we've been finding more significantly and more importantly as we've gone longer and longer into this period of time, how important it is just to make that phone call. And people are so appreciative of the contact. You don't know who's feeling more isolated and who's not.
Yeah, Dave, it's so important now because there are people in this community and even friends and relatives of all of ours who just need to know that you're there for them just because of the time. So if anybody can do anything, just to pick up the phone. I know sometimes, it's easier just to plop down on the couch and watch the second half of some movie, but pick up the phone for 10 minutes, call somebody.
Yeah, no, absolutely. Thank you for saying that.
Okay.
So before we move on to talking about the Upper York Sewage Solution, which is the main reason I've asked you to come on the show, I want to ask you about the regional strategy in this pandemic. York Region Council had initially asked that the region be exempted from the restrictions imposed on Toronto and Peel. Now we have Regional Councillor Carmen Pirelli is calling on the Premier to reopen businesses in York Region after January 23rd. But the argument is, if York Region was going to be the exception in the provincial lockdown, it would attract a migration of outsiders to the region, further increasing the transmission. So what was the logic of Regional Council at the time of their request? And I'm going to ask you if you agree with the position taken by Councillor Pirelli.
So I think the issue is, if there's a lockdown, it's a province-wide lockdown, and the requirements to do the things that we're all doing, and congratulations to our frontline workers and everyone else for doing what they're doing. But the big issue going back was the balance between those businesses that were allowed to stay open and the small businesses throughout this community, throughout the other communities, and throughout the province of Ontario that, quite frankly, were put into a bind. They were initially asked to invest in protective equipment. They did it. You and I know you can go into stores in this community. They've spent thousands of dollars to prepare themselves. And yet, for whatever reason, and we asked repeatedly to the province of Ontario, why is it that I can go to Costco and I'm buying products, or I have the ability to buy products that are available at all those small businesses, especially when the medical officer of health for the region of York said there was no transmission through retail stores, which was a little bit befuddling to begin with. So I think the intent was not necessarily for York Region to go its own way, but for the province to understand that there's got to be a balance somewhere. And I think going forward, the small businesses in this community and throughout the region of York and throughout the province of Ontario need to understand why it's a different set of rules for them and for big box stores. So do I agree with Councillor Pirelli? I don't agree with the way he's gone about it because it's within your own ship. I think the province of Ontario should have taken a much different approach. But since they haven't, we'll live with it. We'll work the best we possibly can. We'll wear our masks. We'll wash our hands. We'll do whatever we can because we've got to get back to whatever that new normal is.
Great. Thank you very much for clarifying that.
Okay.
So I want to go on with the Upper York Sewage Solution because there's been so many choppy and partial reports over the last period of time, and I want to get into understanding where we are right now. But before we even start talking about that, I'm going to ask you to remind us, what is the UYSS and what threat was it seen to represent?
Okay, so, this might take a little while, but the Upper York Sewage Solution was a program that was initiated by the province of Ontario for growth that was to take place and is taking place in East Gwillimbury, Newmarket, and Aurora. A total of, I think, about 150,000 persons. It was, I guess, about 12, 13, 15 years ago now when the province said to the region of York, we want you to look at this alternative. But before we talk about the alternative, everyone should understand that the growth for Aurora, Newmarket, and East Gwillimbury was always intended to go to what's called the York-Durham sewage system. The York-Durham sewage system is a system that runs through the region, runs through Markham. The infrastructure was built there, and it goes down to what's called Duffin Creek. Duffin Creek is on the shores of Lake Simcoe. It's in Durham region.
Lake Ontario, you mean?
Sorry, did I say Simcoe? Yeah, Lake Ontario. Sorry. And it is a $1 billion plus facility that treats the waste for majority of York region and for all of Durham. And it is, my analogy is that you're draining and you're doing the work for sewage purposes into an Olympic-sized swimming pool where Lake Simcoe is like a thimble. So for whatever reason, the province of Ontario, in their wisdom, decided to tell the region of York, you have to look at another option. And that option was Lake Simcoe through the Upper York Sewage System for the growth that was planned. And you should know, in the early 90s, and I guess it doesn't hurt to be an old politician sometimes, I sat at the table of the region of York when the discussions and the infrastructure and the funding was put in place to accommodate all that growth into the York-Durham sewage system into Lake Ontario. So I had a little bit of a history that I understood.
Well, that's why I wanted to ask you this question, because I don't think anybody has as big a grasp on it as you do, Rob.
So when the province of Ontario, in their wisdom, said, we want you to look at the northern solution, the first thing that I said, and Dave, you sat with me on council, said, why? And we said, no. And probably the thing that got our backs up the most was when they did the environmental assessment. The environmental assessment was for those three communities, East Gwillimbury, Newmarket, and Aurora. And they didn't talk to anybody in the town of Georgina. Yet we were the ones that were going to be affected by the drainage of the Upper York sewage system into the Holland River, eventually into Lake Simcoe, at a rate of 40 million liters of treated sewage per day. My calculator doesn't go that high, but over the course of a year, I think it's a couple of trillion liters of treated sewage. Granted, the environmentalists and the engineers will tell you that treated sewage is, it's great stuff. You can almost drink the water. Maybe that's an alternative, but I won't go there because my friends won't agree with me.
Well, just to be clear, Rob, not every environmentalist was in agreement with that perspective. That because there's still a definite quantity of phosphorus, albeit diluted, still a definite mass of phosphorus being added to the ecosystem. Yeah,
you're right, but I was surprised. I got to tell you, Dave, I was surprised at there wasn't a volume of, and you and I sat on council with Maple Leaf Estates and all the discussions as far as Maple Leaf Estates, and we were doing what we needed to do because the legislation that was required to change that was something we had to rely on the province. So, we did what we could, but there wasn't the volume of discussion until one day when at the region of York, that issue came before regional council in a committee meeting at the time when I was on the Environmental and Transportation Committee. And the chairman of the region of York at the time, who was Bill Fish, started talking about the Upper York sewage system. And I was in the meeting and I said, why isn't the town of Georgina involved in this discussion? And he said, well, you don't have to be involved because you're not part of the environmental assessment. You're not part of the area. But I said 52 kilometers of our shoreline of Lake Simcoe is where you're going to, the effluent's going to end up, even though it's treated. And he said, well, it doesn't matter. That's the way the environmental assessment works. And I said, well, it does matter. And I took it from that point on. And the one thing that I did after I left that meeting, Dave, because I asked in the meeting, I said, well, have you engaged everybody else? Yes, we have. I said, have you engaged the Chippewas of Georgina Island? And they said to me, I can remember them saying to me, yes, we sent them a letter. I left that meeting. I phoned Donna Big Canoe and I said, Chief Big Canoe, I'm not sure how the Indian Act works and I'm not sure how consultation works, but does a letter from the region of York with respect to a major sewage treatment plant on Lake Simcoe suffice for consultation? And she said, no, it sure doesn't. And from that day forward, the Chippewas of Georgina were very involved, and thank goodness they were, because we as a province and as a community should have been working on their boil water advisory, not forcing them into a discussion as far as whether we needed 40 million liters more of treated sewage going into Lake Simcoe every day.
I just want to pick up that point you said, Rob, because you said it very quickly. The Chippewa of Georgina Island are still under a boil water advisory, correct?
Yeah, it's a shame.
Yeah. For years.
Yeah, so having that pretext, we've taken it all along, and the region has spent a lot of money. And frankly, I felt like I was a little bit of a loner for a long time because I was constantly uninterrupted. I was opposed to the Upper York Sewage System. When I ran for council 2 years ago, my number one priority, that people can go and search for my literature, was I was in opposition to the Upper York Sewage System. I certainly heard from other elected officials that they weren't happy with my position because the region of York was being told what they were supposed to do. But I was steadfast, and every time I had a chance to speak to someone at the province of Ontario, whether it was the Minister of the Environment, Mr. Urick, or our representative, I kept on reiterating, why? If you go on to the Holland River or you go into South Cook Bay, you'll see what it's like. And Dave, I'll tell you very quickly, when I was first elected as the mayor many years ago, a guy by the name of Lloyd Crate, people will understand the old crates, Lloyd Crate, old crates. He phoned me up one day. I was a rookie mayor. He said, Mr. Mayor, I want you to come for a boat ride with me. I said, sure. I didn't know what I was getting into, but he took me down to the south end of Cook Bay, and he said, when I was a boy, I used to swim in this water. Look at it now. He said, with the silt and the growth and everything else, he said, can you do me one favor? During your political career, could you at least address the issues with respect to Cook Bay? I said to him at that point in time, I said, Mr. Crane, I'll do everything I possibly can. So I've kept my word to the people of Georgina. It never should have been considered in the first place. And then we got a letter, the region of York got a letter in July, and that's what we should probably talk about now, is that letter.
Yeah, and that's where we're starting in on, because as you said, this secret letter is probably one of the worst kept secrets, that the letter was dealt with in private, because I know a lot of us were talking about that letter. And the province's Environment, Conservation and Parks Ministry, I guess, was the one who sent the letter. And what did that, to regional council, and what did that letter say?
Well, I wasn't allowed to talk about it for about 3 months. What it did say is it said to the region of York that the province of Ontario is going to take another look at the southern solution, which was the York-Durham sewage system, and whether the 40 million liters of treated sewage a day shouldn't go into Lake Simcoe, and whether they should be included as they had originally been planned. And I want to emphasize that. They were originally planned to go through the York-Durham sewage system. So the province said, let's re-look at that. And in the interim, we'll talk to you about the other issues with respect to the York-Durham sewage system and the Upper York sewage system.
Okay. Now, just want to be clear on the first point then. Is the direction of dumping this additional 40 million liters per day of sewage into Lake Simcoe via the Holland River, is that proposal closed off now?
Well, good question. I would hope it is. I would hazard to guess at this point in time, it's not closed. There's discussions that are taking place. There were investments that were made by the region. So it's still an ongoing discussion. That's where people in this community need to speak up.
And when we come back from break, I'm going to ask you who's going to make that final call. So stay with us on Politically Speaking, Insights and Issues, talking with Rob Grossi. Welcome back to Politically Speaking, Insights and Issues. I'm Dave Szollosy, and I'm speaking with Rob Grossi, Deputy Mayor and Regional Councillor for Georgina to York. And we're talking about the Upper York Sewage Solution and what's happened to that. And my question I left with Rob before we went to break was, with this letter now that's been sent by the province to the region, can we take that as assurance that the Upper York Sewage Solution to dump all this pollution into Lake Simcoe is over, that avenue is closed off? And Rob, you were just in the process of answering.
So, Dave, I'm not sure whether we can close the door. I think we've got to be still as diligent as we were, but there are some challenges going forward. The growth in East Gwillimbury, if you remember, East Gwillimbury was supposed to be where a university was in York Region many years ago.
That's right.
And that growth was included in the York-Durham sewage system. So the growth that's occurring there, the growth in Newmarket and the growth in Aurora is still going to exist. And they were relying on some sewage capacity for those three communities through the Upper York sewage system. So frankly, they've been, and I understand it, they've been somewhat quiet. They just want to make sure it's done and the infrastructure is in place. So if the province is going to direct and lead the way on the York-Durham sewage system, so the sewage would flow south, there have to be some issues that have to be dealt with very quickly to put that infrastructure in place, including the fact that East Gwillimbury still has sewage lagoons. And those lagoons need to be closed. I empathize for them, but I don't empathize with the fact that there weren't a lot of people that were speaking about Lake Simcoe and the health of Lake Simcoe when the Upper York sewage system came to the table for the very first time. So I think what we've got to do is we've got to remind the province of Ontario that it makes more sense to use the billion-dollar facility that's on the shores of Lake Ontario and abandon the Upper York sewage system and do what they did just recently, and that's spend the kind of money for a phosphorus reduction facility, $40 million, on the Holland River to better Lake Simcoe. Why would you spend that and still do 40 million liters of treated sewage every day into a shallow river, into a shallow bay, into a pristine lake?
Right. Yeah, well, I was very excited. I was at that press conference where they announced the phosphorus removal facility, but I do notice that there are no concrete plans on the books yet to begin construction of that. So it's still a future down the road. The question I want to ask then, whose decision will it be to confirm a southern route for the York Region sewage as opposed to the Lake Simcoe destination? Is it
York,
is it provincial?
Yeah, so York Region has a report that was on our meeting last week. It's coming back next week, and York Region's position at this point, the staff position, is to keep all the options open. My position is based on what the province of Ontario has said, is close the Lake Simcoe option, concentrate on the southern option, help East Gwillimbury get rid of their lagoons, help those communities get the capacity that they need for their growth, but just get on with it. Do what was originally planned and was in some ways funded, because the pipes that were built on 16th Avenue through Markham were to handle the capacity that they had changed for the Upper York sewage system. So I think I'm going to oppose what's being said at York Region as far as looking at both of the options going forward. I think that they should abandon the Upper York sewage system under the guarantee through the province of Ontario that the capacity for the growth within those communities can flow south through the York-Durham sewage system.
Now, I don't know if you can answer this question, Rob, but,
Sure.
but what brought about this change of heart on the part of the province?
Oh, that's a great question, Dave. And I think probably because there was a change of government. And with the Minister of, I can tell you when I would go to the Association of Municipalities of Ontario meetings, I very, how can I put it, nicely cornered the Minister of the Environment and let him know about this very important issue in my community. And he listened very intently to me. And I think he heard from a lot of other people, including, I'll give credit where credit is due. I think our Member of Parliament has had an open dialogue with the minister. So I think there's people that have spoken about it. And I think, I get it. I understand the technology and the engineering and everything else there, should keep us fail safe. But that's been said a million times around the world in other organizations and other issues. I just don't think 40 million liters of treated sewage per day into Lake Simcoe, into a shallow river, into a shallow bay is going to do anybody any good.
Well, I mean, it's a clear distinction between Lake Ontario, which has an outflow to the Atlantic Ocean, ultimately, and Lake Simcoe that really doesn't have any outflow and loss of water other than through evaporation, which would only concentrate the contaminants further and further all the time.
And anyone that's lived on Lake Simcoe in the last 15 years has noticed a marked improvement, because there have been some work that's been done by the Conservation Authority and others to make it better. So why regress when we've taken great steps forward?
But Rob, the water in this lake is nowhere near like it was when you and I were kids playing in it all the time.
Hey, we could do a whole show on your old store down in Island Grove and the days when we, spent every day, every minute, every day on
in the water. Rob, it's been great talking to you again. Thanks an awful lot for coming on the show. Thank you very much, everyone, for tuning in to Politically Speaking, Insights and Issues. I'm your host, Dave Szollosy, and we'll see you next time.
Thanks, Dave.